There we go. All right, and we are live. So I'm live here with, let's see, let's go live there, and we're all set. Yes, so we are live. All right, so we're going to talk about the Health and Wealth Expo Live Summit. I have the infamous Dr. Efrat LaMandre, also known as Dr. E. So we're going to be talking about, so you guys know that we are hosting the Health and Wealth Expo Live Summit taking place on May 15th and 16th. If you have not registered yet, you are missing out, and I do not want you to miss out. Such a lineup of great speakers. And, you know, a question that I often get asked is, what's the difference with this summit? Well, let me tell you. Our summit is rooted in really addressing the systemic bias, right? The lack of leadership support, the missing mentorship. And we're really advocating for health, wealth, and wellness, and through the lens of entrepreneurial journey. So we're going to be talking about, you know, how you can monetize your expertise, right? How you can really escape that ceiling that you may be facing in the traditional setting, whether that's because of bias, whether that's because of lack of diversity, or whether that's just because, you know, you don't know what else to do. And there's a lot of things going on in healthcare right now, and we want to help you to really escape that. So we have great speaker lineup, including Dr. A, who's going to be talking about the medical gaslighting that goes on. And this really incorporates, to me, and I'll let her talk a little bit more about it, this really incorporates that wellness aspect, right? So the beauty of what we're doing, if I didn't mention this already, is we're blending that health, wealth, and wellness into one expo. A lot of people want to say like, oh, your health and wellness expo. No, it's the health and wealth, because we're incorporating wellness inside of the journey. So thank you so much, Dr. E, for being here. Thank you for being willing to share. I mean, I'm excited about your topic and what you're going to be talking about. When we talk about medical gaslighting, I'm like, okay, yes, we need to talk about that. So share with everyone who's watching, share why you agreed to speak at the Health and Wealth Expo.
You know, it's funny, you talked about medical gaslighting, and anytime I say that, I've never heard someone say, I don't know what you're talking about. Everyone says they've experienced it, or someone that they love experiences. And medical gaslighting is an invisible epidemic. People are dismissed, misdiagnosed, left questioning their own bodies, and they don't even realize it's happening sometimes. So, you know, if you ever been made to feel like you're exaggerating the symptoms, or you're just fine and you're just exaggerating it, I'm here to pull back the curtain, to give you the language for what you've experienced, and to show you how to reclaim the power inside of healthcare system. And what better place to do it than this summit, the Health and Wealth Expo Live, right? Because this is about inspiration, education, and empowerment. And this speech will help you get empowered around your health.
Awesome. Highlight a little bit about what you're going to talk about, just so give them a little dose.
Absolutely. So first, I'll explain what medical gaslighting is, and also what it isn't. And I'll explain why it happens, but not from a place of blaming doctors, but by exposing the limitations of the entire medical system. And then I'm going to give people tools to recognize when it's happening, why it's happening, and strategies to get yourself unstuck.
I think that's so important, because I think a lot of people don't know the questions to ask, right? And they don't realize when they're being gaslit, and it's huge. And that's where that diversity comes in. That's where that having, when we talk about leadership, right? I know I might be going off topic a little bit, but when you consider leadership roles and having that lack of diversity in those leadership roles, the community isn't always represented well the way it needs to be when it comes to decision making, right? And when it comes to community health. Because if you have the same type of people making decisions in certain executive roles, it's not really taking into consideration different cultures that may be represented in that community, or that lack of representation. So people, you know, sometimes are overlooked, and that's where that mistrust may come in when it comes to their caregivers and their providers. So I think your conversation is a great, your topic, I should say, is such a great addition to the expo, because of what you're going to be telling them and what you're going to be sharing. I'm sure you're going to share some great stories behind, why you even started, right? Talking about medical gaslighting, because it really does go on.
I absolutely will share stories about why this happened. I call myself a recovering medical gaslighter. But to your point, there is no question that this is happening more to women and women of color. There's no question that they make up the largest amount of victims of medical gaslighting. Without question, the dismissal is real.
It is. It really, really is. I talk about on my podcast. I talked about a show that everyone who listens know I love. It's this show called The Resident. That's like new to
Yes,
me.
I watch it. My wife and I watch it all the time.
It's like new to me. I'm like, why no one told me the show existed? But I can go off about it. I don't want to go off topic, but I mean, the point is, watching that, sometimes you see like, yep, that happened. I think there was even an episode that clearly was like clear classic of what happens in healthcare and why it's important to really know who's providing you, who's your provider.
Yes.
Who's taking care of you, who you're trusting with your health. And this is why we're going to have a whole vendor marketplace when we talk about blending health, wealth, and wellness. One of the vendors, she has jewelry that helps you with your hormones, right? So, and this is how we're blending the wellness aspect by, again, having a whole vendor marketplace, educating you on what you should know in today's environment of what's happening. I mean, there's so many uncertainties in the world, and I want in the government, in the in the country. So, and I want people to realize that there are people out here. We're out here. There's providers out here who you can trust, who you can come to get inspired. And for those providers who want to be able to do something different in the community, I want them to be able to do just that, because that was me. So me starting my wellness business, that was health promotion for me. That was, self-care advocacy. And I know there's other healthcare providers who they want the same thing, right? They want to be able to break that glass ceiling and know that it's not just, you can make a difference more than just in the traditional setting, right? There's so many other ways to do it, from starting a mental health practice as a nurse practitioner. Dr. Linda Logan is going to be talking about that. Even real estate investments, right? Like we're not always taught these things, and it's important for us to know. And I know I'm talking a bit, but I want to hear your words. Like, why do you think people should come to this summit?
Yeah, so I think almost everyone listening has at some point been told everything looks fine, everything looks normal, but something inside of you tells you something's not right. And if you felt that, then this is for you. If you've ever been made to feel like your symptoms are imaginary, exaggerated, or that it's your fault, something you should do, sleep more, walk more, but you're like, I think there's something more, then this talk is for you. Because understanding medical gaslighting doesn't just help you heal faster, it helps you take back control, because a lot of times we feel that we've lost control in the healthcare journey. And again, the Health and Wealth Expo is the perfect place for this. I love that it's a 2-day summit of various ways. It's not just health, it's not just wealth. I just love that it's put together. And this is a perfect spot for it, perfect audience for it. And I'm just very excited to be part of this.
And I'm glad you are too. I really am. You can definitely check out Dr. E at the Health and Wealth Expo Live Summit, May 15th and 16th. Dr. E is also going to be a part of our DEI panel, right? Our diversity, equity, and inclusion panel, where, listen, we're going to be really breaking things down. So again, it's not the workshops. A lot of people say like, oh, well, I'm not interested in starting a business. The summit is so much more than that, right? And I was just having a conversation about how we go to these summits and we're sitting there and we're bored and we're on our phones half the time. And this is not that, right? Like, this is not that. We're bringing workshops, we're bringing business plan development, but we're also talking about very important issues. And the DEI panel is one of those discussions that's going to be one of those important issues as well. It gives you an opportunity to ask questions. I know with so much fear, people have questions and what they should know. So from your talk to top it off with the discussion on DEI, I think it's going to be such a game changer. And we're having a pitch competition. I don't know if we talked about that. I know I can be all over the place, and I don't want to be. I'm trying not to be. But again, I say that to say that's the difference with our summit. There's going to be real talks, real conversations, real activities going on, real true engagement. And it's things that we need to know as a community, these things that we need to know that affects our health, right? And that ultimately affects our wealth. So what do you have to say? Or I guess one last question would be, why do you think the conversation on the DEI panel is so important to add to this?
Our voices matter. You know, I'm bringing up the rainbow community. It's important for one to be heard, but also for others to see people who look like us in these positions on these panels speaking about these topics. It's important that we serve as role models for each other and the younger generation. And no one else is going to speak our truth. So we just have to, as often as possible.
Absolutely. It's important to have. It's important for us to use our voices, hence nurses with voices, guys. So so definitely thank you so much for sharing. I can't wait to see you May 15th and 16th. If you have not registered already, please head over to healthandwealthexpolive.com. You're going to be in for such a treasure, such a treat on these 2 days. I'm excited, I'm sure you can tell. The speaker lineup is amazing, as I mentioned, and you just don't want to miss these activities that are going to be going on. So any last words, Dr. E, before we head out?
Go buy your tickets. What are you doing? Click right now.
Not now, but right now. All right, well, stick around. Thanks so much. All right, guys, thank you. Thanks for tuning in, and talk soon.